Congressman, you're recognized for 5 minutes.
Thank you very much, Madam Chair, for allowing me to participate. Let me begin by saying that, as a practicing pharmacist for over 30 years, confidence was extremely important. When I recommended a product an over-the-counter product to a patient, it was important for me to be confident and to exude confidence that this was going to work for that patient. So, having said that, we've spent a lot of time today talking about the politicizing, if you will, of this whole vaccine and this whole process. And I want to just say that as a healthcare professional, as a pharmacist, I find it irresponsible that members of Congress would be doing this. This is something that we should all be together on. I've dealt with the FDA. I have seen the process work. Over 30 years, I've seen products that went all the way up to the 4th stage, and then we're not allowed to go any further. I've seen that happen, and that has built up confidence in me in the process and knowing that the process works. So that's all I'm going to say about politicizing this whole ordeal. I want to talk about something that's very important, and that is distribution of this and making sure that we have the process in place. Specifically, the critical aspect of allowing pharmacists to be able to administer this vaccine. Dr. McClellan, I want to ask you, 95% of all Americans live within 5 miles of a pharmacy. Pharmacists are the most accessible healthcare professionals in America. In order to make sure that when we get this vaccine safe and effective and when it is out there, in order to make sure that it gets out, would you agree that pharmacists need to be able to administer this COVID-19 vaccine?
Yes, Representative, I agree. We've got experience in the pandemic of pharmacists playing a critical role in access to testing and helping people respond more quickly, get greater access there, in helping with flu vaccines and other issues that also play into the pandemic, as we talk about already today. And they're also an important part, as you said, of that trust. People still trust their health professionals, their doctors, their pharmacists, even if it's gone down for FDA, unfortunately. And that's another check on making sure that we're going to really have an effective vaccine that can be brought to the public. So pharmacists have a critical role to play in this.
Well, I appreciate that. I always tell one of my favorite stories is the fact that I went from being a pharmacist, the second most trusted profession in America, to being a congressman, the second least trusted profession in America. But the point I'm trying to make here is that it is important for pharmacists to be able to administer that. Now, we've got a situation where a lot of the states have authorized it, but we need a blanket policy, if you will, so that we could have all pharmacists, whether it be independent retail or chain retail, to be able to administer this in order to get it out quickly. Dr. McClellan, you were a former CMS administrator, and I wanted to ask you, you're aware of the issues that deal with pharmacists getting reimbursed and being able to bill Medicare for these types of things. This has led to a lot of problems, and right now we're trying to get a temporary pharmacist provider status, so that pharmacists will be able to get reimbursed for administering these vaccines. Obviously, we've got to have insurance, we've got to have coverage, everything that we should have in order to administer these vaccines. That is something we've been working with CMS with and trying to get that done. Do you agree that Congress should grant temporary authorization for pharmacist provider status to be able to administer this vaccine?
Well, Representative, if that's what it comes to, as you know, CMS has authority to expand scope of practice and coverage in a public health emergency. When I was there, we did that in circumstances like in Hurricane Katrina. So there are some precedents for handling this administratively. But I think this goes to one of the themes from today, is that while there seems to be broad agreement that FDA's processes around approval and to make a vaccine available are in good shape, they're sound, they're science-based, we all have work to do together on the distribution and access to the vaccine, where that depends a lot I'd love to see more activity at the state level, the local level, focusing on that, since we do have a good program in place for the safety of the vaccine itself.
Right. Well, Madam Chair, again, this is not a partisan issue with pharmacists being able to be granted provider status in order to distribute and to administer these vaccines. And I would solicit your help, as well as my colleagues on the other side of the aisle, as well as everyone on this committee, to be able to help us to get CMS to grant temporary provider status for pharmacists to be able to administer these vaccines. And I thank you, and I yield back.